and owner of Your Beautiful Aesthetics, and where we do hormones, weight loss, and all things aesthetic, including laser as well. And this is Christina Johansson, nurse practitioner, and also, she pretty much does all the things as well, hormones, weight loss, and then she's doing all the injectables also. And she's wonderful. She's done my face. And so I just think she's just got such a niche. So we're just so excited to have her as part of the practice. So if you haven't already met her, we'd love for you to do so.
Thank you, Jen. All right, I'm going to go ahead and get our PowerPoint up and running here. Give me 1 second. All right. And off we go.
Okay, so Fountain of Youth, like that's actually what I really love to call Radiesse because that's what it is. Like it basically is giving back what we are losing every, minute as we age. So the objectives of our presentation today would be just reviewing the overall physiology of skin aging, the key components of our skin. What is Radiesse? How does it work? What are its benefits? What is the actual process? What you guys can expect. And then the results you can expect, safety and side effects. We're going to do a little demo and also have questions as well. And please stay through the entirety. We won't try to keep you guys long at all today, but there are some really special offers that we want to get you guys in on.
All right, so we're going to jump right into how our skin changes with age. So, there's some visible signs and there's some below the skin changes that we want to talk about. So, visible signs, our skin just kind of gets rough and dry as we age. We can start to notice some fine lines and wrinkles. There's some drooping and sagginess and some skin laxity that kind of creates jowling. There's transparency because we have thinning of our skin, that top layer. There's more fragility in our skin. There's flattening in the area where there used to be really supple skin. And then our skin can actually become more easily bruised because there's just thinner blood vessel walls. And then below the skin, so we don't want to have fat really anywhere, but we actually want it in our faces. So those fat pads actually create structure. So as we mature with age, we lose those fat pads and we lose that in our cheeks and our temples and our chin and our nose. And it just leads to a more sunken, kind of a deflated appearance because there's loss of structure. Additionally, below the skin, we lose bone. So over the age of 35, the number of bone regenerating cells actually decreases. So the bones around our eyes widen, and that leads to some, eye hollowing, flattened cheeks. Bones in our central face and our jaw actually degrade and it becomes more recessed. And then we lose cartilage in and around our nasal tip and in our bony structures. And then there's loss of collagen and elastin.
So depressing.
It is very depressing. Like, what the heck?
All right. So, as we age, our body's collagen and production decreases, and the cells that our body uses to produce collagen, which are the fibroblasts, are no longer able to produce as effectively as they once did. So, the existing collagen becomes fragmented, bent, unorganized, and the age-related loss causes folds and wrinkles into the skin, loss of elasticity and moisture. I love this analogy, thinking like a mattress, where for a good bed, we need like a nice platform, like a box spring, and then the mattress, which is the cushion, which would equate to the collagen and elastin in the fat cells, and then the sheets being the skin. So when we don't have either the structure or the collagen and the fat component, then there is sinking because we don't have that support. We start to lose collagen starting at age 18. We lose about 1% every year. So by the age of 50, we've already lost about 30% of our collagen. And so there's, genetic factors there too, but then there's also environmental factors and things that we can do to like slow that down, including limiting sun exposure, wearing sunscreen, not smoking, or, being around pollution, and avoiding stress, and obviously all the other things we can do for skincare and our overall health of our body.
So The topic of the hour. What is Radiesse? So, Radiesse is the only regenerative dermal filler that provides immediate results while revitalizing five key components of the skin. So, we'll touch on those in just a minute. But really, Radiesse is considered to be biocompatible. So, it's made from calcium hydroxyl apatite, which is a naturally occurring mineral found in bones and in teeth, actually. And biocompatible just means that it is naturally occurring materials that are well tolerated by the body. Radiesse also is considered to be a biostimulant, meaning that it triggers your own body's natural collagen production, which then leads to gradual restoration of volume and improvement in skin integrity. And then Radiesse is proven to show long-lasting results. So those results can last up to 12 to 18 months. And then certainly we do recommend maintenance, which is a touch-up with treatments every 12 to 18 months as well.
So there's five key components impacted by Radiesse, and this includes collagen one, which is the support and the strength and the resilience of the skin. And you've all heard of collagen, but something unique about Radiesse is that it also produces collagen three, which actually helps to organize those collagen one structures and helps the extracellular matrix and helps organize them into like a fine meshing so that it actually provides support to the skin. Elastin as well. Elastin is the snapback of the skin. So like if you think of like a rubber band, so this is to help with the firmness of the skin as well. Protoglycans, which are more on the surface, provide that nice glow and hydration. And then Radiesse also stimulates angiogenesis, which is a long-term sustainability of the new tissue.
So how Radiesse works, so first it's injected into targeted treatment areas, which could be the cheeks, the jawline, the nasolabial folds around the mouth, or even in the chin. And that Radiesse is, it's suspended in a gel carrier, and that's what helps provide that immediate and visible correction to the skin by adding volume, and that smooths out those fine lines and wrinkles. And then over time, that gel is absorbed, and those fibroblasts then appear. And those fibroblasts lead to neocollagenesis, which begins as those microspheres kind of disintegrate and stimulate the gradual growth of your own collagen, building structural scaffold, and that stimulates that collagen production for a year or longer.
So I love this slide, and many of you that are my patients probably have heard this before because I love to show this picture of how we start if we have like lack of that support, we have the sinking of the skin, and which is usually like a fold or a wrinkle that we see visibly. Injecting the Radiesse below the skin is going to give that immediate effect because it does have a gel carrier, which actually is similar to the other dermal fillers to add volume that's immediate. And who doesn't like immediate instant gratification really? So that's why I love this product as well. And then so you get that immediate effect, but then over time it's going to work to stimulate that own collagen production and the nice scaffolding there that is long lasting.
So one of the other neat things about Radiesse is that we can actually hyper dilute it, meaning we can kind of not water, well, we can water it down so we can spread it into other areas. And some of the other places that we can put the Radiesse, the hyper dilute Radiesse, is certainly into the face. We've been talking about the face, but we can actually fan it into kind of the cheek area here. We can do the neck and the décolleté. It can go into the buttocks, thighs, arms, abdomen, knees, really anywhere that there's skin laxity, loss of volume. And when we do hyperdilute Radiesse into those areas, what we're doing is helping to promote that production of new collagen and elastin. So we're getting more tight, more supple, more youthful looking skin.
So we can use it in the straight form from the syringe just for more structure onto the bone. And then the hyperdilute just helps with like a general overall tissue regeneration. One of the areas that we can do, which is gaining more popularity is the hands. Some people are bothered by their hands. Some people don't really care about their hands, but hands really can age us. Like as we age, we can actually see the volume loss, and then the veins become more visible. And so it's a really easy, comfortable procedure to get the Radiesse injected into the hands, and then also we don't have a slide on this, but like doing the buttocks, the booty is really a popular, and that's a very natural look of just building collagen to help with sagging of the behind. And so you can inquire more if you'd like on that.
All right. So as far as the treatment process itself goes, so you'll get a consultation by myself or Jen, where we kind of discuss your overall treatment aesthetic goals and determine if Radiesse is the right product for you. We then move through that appointment and apply a topical numbing cream. Our goal is to really minimize any discomfort. And certainly we can also do some lidocaine injections into the areas that we're going to be going. And then we've got vibration tools, we've got squeezy balls. So really want to, make it as comfortable as possible. Then we would move through and do the injection itself, which is into the targeted treatment areas that we've identified. And that can be with a fine needle or a cannula. And like I said, generally really well tolerated. As far as post-treatment goes, so there certainly can be some redness, some swelling, discomfort, bruising, typically mild, and those subside within a few days. You can certainly ice the area. You can take some over-the-counter Tylenol. And we do always follow up with some post-treatment instructions. And our goal is for you to have the most optimal result.
Absolutely. And so the safety behind Radiesse, I mean, Radiesse does not come without risk. Any injection, there are safety protocols that we follow as a practice. And Christine and I are very well versed on your anatomy and where what's safe to inject and what's what is not safe. So we are very mindful of that. And the side effects are usually mild, like Christina mentioned. They can last a couple, like the worst is usually a couple days, but then overall swelling can last up to 2 weeks. So we usually say don't plan like a big event or a wedding. Like it's always like kind of a long running joke with like aesthetic providers. When someone comes to your door and they're like, I'm getting married like next week, it's like, no, like because
Give us time.
yeah, we really want to have time for anything potential, or it's like, you're not going to bruise me, right? I'm going to be on TV tomorrow. It's like, it's a lot of pressure, So like, although a lot of the times people do fine, we usually tell you like to expect the worst because then at least if something does happen, then we can prepare for that. And less common side effects, that there is like a lump or a bump or an asymmetry, like we want to see you back, like because we can fix it. Like there's rarely any instance when we can't make it better to make you happy, and that's what we're all about here, is like making you pleased with your results. So I'm going to show you a couple before and afters that Christina and I have done. This nice young lady had just some sinking of the hollows of her eyes, and that was her main concern. So this was a really good result, and I just had recognized by looking at this frontal picture more her lack of cheek volume on the lateral and the malar sides of her cheeks. And so just adding some Radiesse more so on the lateral cheek really gave her more definition back here. And then I also added some in the middle here to just pop her under eye. But then look at how much better her nasolabial folds are as well. So she was really pleased. And then this patient, we also just needed to add some more volume in her face just for structure. And so giving her more of a cheek definition here and a jawline really just helped her overall appearance. I mean, her results were just amazing. So if you can kind of just see like how her jawline is a lot more defined in through here. I think we did a little in her chin as well. And yeah, it really just helped her nasolabial folds as well, as you can see and through here, the difference.
So this gentleman I had the pleasure to meet and treat, and he was kind of really hoping for some better facial balancing and really help support his lower face. So we targeted these areas. He wasn't so excited about the jowling. He wasn't happy about that recession. We talked about as we mature with age, how our jaw kind of recedes. So what we did was really focus on the lower face. We added some chin for some nice profile balancing. We did some filler or some Radiesse in the jaw and provided some more defined structure. And you can even see from that front profile, it's a lot more sharp. So he was super pleased with his results.
Nasolabial folds too.
Yeah,
Are
a lot
much
softer.
soft, yeah.
Yeah. Yeah. Nice and sharp,
Mhm.
more defined.
So, and then our model happened to, we just found this girl on the street and so like, hey, you want to be our model? And they're just
Let's
kidding.
all be vulnerable for a second. It's fine. It's fine.
So, but these are Christina's before pictures, and Christina had always kind of mentioned, if you don't mind me
No.
mentioning, that she's always been kind of self-conscious about her chin and some recession there. So we've been talking for a while about injecting her, and then it's like, well, what better time than the present here? So, but that was kind of our main area here. We had done a little bit of cheek on Christina in the past, but I also wanted to kind of do a little bit more to lift her in the cheek area, and to make her chin kind of more balanced, and then her jawline. And so I'm going to show you guys a quick video here on our injection here, and it's very short, not showing the whole thing, but just to give you an idea. Cleaning her really well first, and she was numbed with lidocaine with topical, and we're adding some Radiesse just straight to the onto the bone with a needle. That may look brutal, but it was actually very comfortable for her. And then the cannula can kind of help us reach different areas that are harder to reach with the needle in this area. And that's also very comfortable. If you're not familiar with the cannula, it actually is we're able to make like a poke and reach several areas under the skin, and it is a blunt tipped catheter. So it's not gonna go through and pierce vessels and everything. So it actually makes it very safe
And comfortable too. You
yeah.
know, you having the cannula done on myself,
Hmm.
you really can't feel it. And it's less traumatizing to that tissue and those structures
Yeah,
underneath. So it's a good technique.
you can see already how that just made such a difference just with that.
Just more sharp,
Yeah.
like
And then I wanted to poke out her chin a little bit more just to kind of even out. And really, we just kind of call this like facial balancing. Especially when someone has more like that nice cheek structure. It's like we don't want to forget about balancing the whole face. And this is also a really nice procedure when people are not happy about like their jowling, it's like lifting, pulling back.
so untreated on that side
Yep.
compared to that side. Like, look at that.
Mm,
Immediate.
so exciting. And then we'll show you her before and afters here. Oops. So in this picture, mind you, she's a little red, but just the difference in that chin projection, that nice jawline definition, and then the cheeks to raise her up. Here the frontal view. I guess that's just kind of showing more like how, because I did add more to her cheeks. And then the side profile here, just giving her more of that snatched jawline, or yeah, snatched. And then that chin production just made such a difference. And we're just I'm very pleased. I hope you are as
I'm
well.
so pleased, so grateful.
And this was just like an hour ago. And so look at her. So like I think a lot of you are, and she's fine. Like a lot of you are afraid to do different injections based on like what you have going on that day. You can definitely like go about your day. She's, I'm gonna stay on her to ice throughout the day, and she may be kind of swollen tonight, but yeah, that's kind of we're gonna kind of get to some before or some questions here. Oh, I just can't see it.
Yeah.
Okay,
Move some
so
stuff out
let's
of the way
see.
here. And then we have some things that came
Couple
through.
questions. Okay, great questions. Oh, good morning. All right, amazing results. How much bruising did you experience? Okay, that was from Jill. Thanks for your question, Jill. So bruising, gosh, everyone can bruise like as injectors, we're like pre-icing. We're trying to avoid like what we can see, like any obvious vessels that can maybe bruise you. But as far as how much did she bruise, I can predict that she might get a little bruise on her cheek there. But and sometimes bruises kind of show up the next day and everything. So that is just kind of always a risk that can occur. We do like you to hold anything that may thin your blood before, like aspirin or and ibuprofen even, but fish oil, avoid alcohol the day before, and be well hydrated. So all those things kind of help with that.
Would you recommend someone taking like arnica?
And you can take arnica too. Yeah, like the sublingual arnica, or even do the creams before. that has been shown in that arnica is a natural anti-inflammatory. And so we have another question here. How often do I need to repeat this? And that is a great question because it's an investment, right? And it's I know I'm fully aware this all this stuff is not cheap, and kind of took me a long time to be able to actually tell people how much things cost. I just like to be like but that's what kind of why I like this product too, like because of the longevity. I truly want my patients to see results. I want them to be happy. We both feel the same, like there's great satisfaction in that, and we definitely don't want them to come back and say, okay, this didn't last. And so but typically, like after you're treated, you may need a touch up even within that first 6 months. Definitely at a year point, we don't want to see it just completely wear off and then start from square one. I mean, like and if you're loving your results, you won't want that either.
Well, and time is not on our side. We're going to continue to keep aging. So we
Exactly.
kind of still need to be in maintenance mode.
And sometimes even just like re-stimulating that collagen production, even at 6 months to a year, is like a really good thing. We might not need as much. We kind of have to play that by ear. We can't really predict that. Sometimes even what we quote, and that's probably the hardest thing, is quoting patients on how much, especially when they might be on a budget. If but we can work with you for sure as far as like how much we do, but sometimes it's we need to treat like fully in the beginning, and then we can just add on and for longevity.
Well, and I love reminding people that, typically a syringe is what, the size of a blueberry. If you squirt out the actual contents of the syringe, really what's in there is about the size of a plump blueberry. So it's really not much. So sometimes we may recommend 2 to 3 syringes, depending on the treatment area that we're targeting.
And sometimes even more. And, to be all honest, we just did. Can I tell them?
Yeah, go for it. Yeah.
We did 5 on Chrisita. So, I mean, so not everyone will need that. And I understand that that's not in everyone's budget, but the next slide is going to talk about our specials. And honestly, we really just thank all of you for joining. And so we just want to pass along some savings to you guys.
Yeah, so just for joining us live today and watching our first webinar, you're going to be able to get $100 off your next Radiesse treatment. So make sure you mention that you were a part of the webinar so that you can take pleasure in that offer. And then some specials that are just going to be running for the month of October. You can buy 1 Radiesse and get free Xeomin in a new treatment area of up to 20 units. So you can save $200 there. And then the other special for October is buy 2 Radiesse and get 1 free, which is like,
really,
that's amazing.
And just if for those of you who aren't familiar with Xeomin, so Radiesse is a MERS product, and we love MERS. And MERS also does Xeomin, which is a neurotoxin similar to Botox. So it's going to help, relax muscles in the face to help with fine lines and wrinkles. So some really great specials, and you definitely can combine those. Like you use your $100 off for any of those specials. And our other October specials will be rolling out. Gosh, what is like tomorrow?
Yes.
Like what?
Hello, it's already Christmas. It feels like I don't know. Yeah. I don't know. All right. So we would love for you to connect with us. So we're going to be posting our Linktree link in the comments. Or if you have your cell phone and you're on a laptop, you can scan that QR code, which will take you to our Instagram. And then Kat is our medical assistant certified laser tech. She has her own Instagram page. I have my own professional Instagram page. So we would love for you to like and follow us so that we can provide even more education and more content for you.
Yep. And we'll also be doing these webinars monthly. And we're hoping that the next one will be on women's hormones. So more to follow.
All right. Well, thank you guys so much for joining us, and reach out if there's any questions.
And that link tree was also just put into the link. So if you need to click on it and make sure to save it as well.